Hi everyone, this is Morgan from the New England QIN-QIO. I wanted to thank you all for joining us for today's webinar on understanding CMS 5-star rating system, how the quality measures contribute to your rating. Before we get started, I'm going to quickly review a few housekeeping items. This call will be recorded for training purposes, and I'll provide you with details on accessing the recording at the end of the webinar. The phone lines are supposed to be on mute, but we are hearing a little bit of feedback. So if you could mute your individual line, that would be greatly appreciated. And we will take questions at the end, and I'll provide you with instructions on how to unmute your line at that time. For now, I'd like to introduce our speaker. Ms. Michelle Pandolfi has 17 years experience in the long-term care profession and is a licensed nursing home administrator in the state of Connecticut. She is a director and has managed National Nursing Home Quality Improvement Projects, Patient Safety, and Care Transitions projects. Michelle helped create the Connecticut Culture Change Coalition in 2006 and maintained an active leadership role. She has spoken nationally about patient safety, culture change, and person-centered care in nursing homes. Some previous work of Michelle's includes managing Alzheimer's dementia units in nursing homes in Connecticut and Rhode Island, and she has worked for the Alzheimer's Association Connecticut chapter for many years as a volunteer, support facilitator, and as Director of Client and Family Services. She holds a master's degree in Social Work Administration and Business Administration from the University of Connecticut, and she also holds a bachelor's degree in Social Work from Providence College. So with that said, please welcome Michelle.
Great. Thank you so much, Morgan. Good afternoon, everybody. Thank you so much for joining us today. We have a lot of information to go through, but I want to make the presentation as interactive as possible. So if you have questions, feel free to put them in the chat, and we'll take them throughout the program if it actually applies, and then we can save them for the end as well. So today we're going to talk about the various data sources that are available for you to monitor your quality and your performance. We're going to compare and contrast those and which ones you should be paying attention to and which one you can validate against each other. We're going to understand the objectives or what contributes to your 5-star rating, and then for you to know which resources to use to understand your data. So as you know, the New England QIN-QIO covers all the 6 states within New England, and this is our website. So please feel free to go on to the website for information, resources, and to access the library of all the educational programs that we provide to you. And if you don't know your state nursing home contact already, here's their information, their names, and feel free to contact any of our team members. They're fantastic, and they're there to help you and support you in all of your quality improvement efforts. Okay, so let's begin. So data and monitoring for quality within your organization. There are various resources that are available to you, both public and private. The public sources that are available to you include Nursing Home Compare and the 5-star program. And I say those separately because they are actually 2 distinct entities on Nursing Home Compare. And we'll talk about that in just a little bit. The private sources that are available to you include your STAR reports and your composite score. And if you're part of the New England QIN-QIO Nursing Home Collaborative, you're already getting those. And if you're not, that's a good reason to join us. Other private sources include your CASPER reports and any internally collected data that you have. So we're going to start out with a quick polling question. How often do you review your CASPER report? Is it monthly, quarterly, annually, or what is a CASPER report? Those are your options. If we can open up the polling questions, we'll give everybody about 30 seconds or a minute to answer, and then once the answers are populated, we'll come back to that question.
Emily or Jennifer, if you guys are on the line, could you open our first polling question? There we go. Great.
So again, what we'd like you to do is be able just to answer, how often do you review your CASPER reports? And just be honest, we're just trying to understand. Part of this presentation is really to understand what your CASPER reports are and the value that they'll bring to you. Okay. So, moving on to Nursing Home Compare. Most of you are aware of Nursing Home Compare, and if you haven't been on it yet, this is actually the direct site that you can go to. It's a link. But Nursing Home Compare searches nursing homes across the country. It was really meant to be a consumer-driven website so that consumers, no matter where they were across the country, had a common way to be able to search for nursing homes. You were able to look to see, mom lives in California and I need to know what's available to her even though I'm here in Connecticut, or my neighbor in New York is right on the corner of New York and Massachusetts and wants to know what nursing homes to go to. This was your way of doing that. And CMS had tried to make it as even and consistently as possible across the country for people to be able to do that. So basic information that's available is demographic information about every nursing home. Health and fire safety inspections information is included, staffing information, quality measures, any penalties that a nursing home may have received during annual survey, and then, of course, the 5-star rating. All right, so the results are up to our previous question of how often do you review your CASPER report. And it looks like the majority of people use it monthly, which is great, and some people didn't answer, so that's okay too, but we'd like you to get involved. We really just want to understand how you're using those reports. All right, so of those who are using them, monthly is great, quarterly is great. Annually, you want to think about maybe using those a little bit more often, and by the end of today's presentation, hopefully you'll change your mind for that. All right, now getting back to Nursing Home Compare. Nursing Home Compare has both your short stay and your long stay quality measures. So they will have your short stay measures include pain, pressure ulcers, your vaccinations, and your antipsychotic medication use. Your long stay includes so much more. You have falls, UTIs, pain, pressure ulcers, physical restraints, weight loss, depression, your vaccinations again, antipsychotic medication use, ADL assistance, etc. Now, your quality measure user's manual, version 8, is the one that's most available. And the link here, and so please feel free to click on that when you have time to be able to look at it, is kind of your go-to document to understand how do I get this information about my long stay or short stay quality measures. So if I want to look up falls, what does that mean? If you look up the user's manual, you'll be able to see what your numerator and denominator are for your falls, who's eligible for that. And you'll also be able to see any exclusions. So if you ever have questions to say, that just doesn't seem to make sense to me, you're able to figure that out through the user's manual. Years ago, when we used to have restraints were pretty commonplace in nursing facilities. You don't see that as often now. A lot of facilities would always say to me, we know we have an issue with physical restraints. That's why our numbers are, our percentage is high, but that's because we're using side rails. Well, okay, so we can look at that, but then when you look at the user's manual, you would know that side rails actually, though it was captured on the NBS, didn't contribute to that percentage of your physical restraint number. So some people could be walking around with some false information or misunderstanding of what is actually contributing to the percentages. This user manual is going to tell you what does and what doesn't. So what do you need to know about Nursing Home Compare? You need to know that not all of your quality measures contribute to your 5-star rating. And so I had mentioned that 5-star is actually different than Nursing Home Compare. 5-star is actually a component of the Nursing Home Compare website. The Nursing Home Compare website quality measures include more than what's just on 5-star. Not all of your quality measures are available on your CASPER report, so that's good information to know as well. So what's publicly reported may not be the same as what you're getting on your CASPER report. And then all of your quality measures contribute to your composite score. And we're going to go through each of these different things as we continue on in the presentation. But just keep this in mind as we continue. So what drives your quality measure data? Well, I hope you all said NDS 3.0 because that's exactly it. What you're capturing on the NDS is actually what's driving your quality measure information. So what you'll see on Nursing Home Compare, what you'll see on your CASPER reports, and what you'll see in your STAR reports if you're getting those through the collaborative. The RAI manual, and here's a link as well, is so important to understanding what you're supposed to capture on your NDS. If you don't have a copy of it, you can download it for free off of this website. And so make sure that you're reading it. And as much as NDS people are doing this day in and day out, it's so impossible to really memorize all the information that's included in the RAI manual. I encourage you to go back to it and read it often, especially if you're questioning what your numbers are really saying, what your percentages on your reports are saying. And of course, you want to pair that with your quality measure user manual as well, and make sure that you're understanding kind of the numerator, denominator, and what drives it. Another good tidbit of information is to make sure that anybody who's filling out your MDS 3.0 actually has a copy from the RAI manual for the sections that they're contributing to. So whether that's social service or your therapy departments or whatever it is, whoever it is, make sure that they have a copy so that they understand how to code, what the intent is, etc. Okay, so now 5-star. Now, I mentioned 5-star as a component of Nursing Home Compare, and that's where you can find that information. So we're going to start with a polling question, actually, before we start into this component of the training. True or false? My facility's 5-star rating is an average of all the categories ratings. So we can open up the polling, and if you can contribute to a true or false. Okay, looks like it's up. And we're going to go back to that as well. All right, and after you actually choose your answer, if you can hit submit at the bottom of that little chat box, that'll help with the polling information. All right. So on the 5-star quality rating system, it is featured on Nursing Home Compare, but it has multiple star ratings. You have your health inspection rating, you have your staffing rating, and you have your quality measure rating. Then you also have an overall rating. Now, if you're thinking about your overall rating actually being an average of the first 3 components, you'd actually be wrong. Your overall rating is not an average of those 3 components. And we're going to go into the math behind the overall rating because it's a little counterintuitive to what most of us may think. All right. Oh, good. And so most of you actually did answer that the 5-star overall rating is not an average, and you are correct. So on Nursing Home Compare, this is a quick shot of what it looks like, and you know that you have 4 different star ratings within that. And the stars mean what you think they would. 3 is an average, 1 star is much below average, and 5 stars is much above average. Now, the way the stars are distributed is actually a little bit, it's based on a bell curve. Now, I'm kind of that mindset if all the nursing homes in your state are doing really excellent work and they're considered a 5-star building, they should all be 5 stars. But unfortunately, as a way to make the stars evenly distributed amongst each of the states, there is a bell curve applied. So the top 10% of facilities scoring in each state are considered 5 stars. The bottom 20% of facilities performing in every state are considered 1-star facilities. And then it's equally distributed amongst 2 to 4 stars for the remaining. Now, the 5-star health inspection domain. We've talked about we have 4 different domains. We're going to go into the first one here and start with health inspection. So your health inspection star rating is actually comprised of 3 of your annual inspections. So when you have surveys, your last 3 surveys are actually what contribute to your star rating. All right, it is weighted. So your most recent survey is actually 50%. Your survey you had last year is considered 33%, and the survey you had the year before that is considered 16% of your star rating. If you've had any complaint or health inspections or revisits in the last 3 years, those are included as well. The rating considers the number and the scope and severity of all your deficiencies. Your life safety surveys and your federal comparative surveys are not included in your star rating for health inspection, but keep in mind that any focus surveys are included. So if you are one of the lucky facilities that may be chosen to have a focus survey, whether it be MDS or dementia or whatever it is, that will be included. And it's included, 1, because it's a survey, and 2, because the way your Department of Public Health in your state needs to enter it into the CMS system. It's considered, it goes under the complaint survey component of it, and so it will contribute to your star rating. Your health inspection ratings are actually based on relative performance within your state, so you are compared against how your peers are doing. And the data is updated each month related to health inspections. And we're going to go over the time frames for how the health inspections and your star ratings are actually updated in a little bit as well. So your complaint surveys, yes, all your complaint surveys are contributing to your star rating, but again, these are weighted just like your regular annual survey. So your most recent survey that you've had in the last 12 months is about 50% of your score, with the one from the year before that at 33%, and the one before that at 16%. Now, if you had a complaint survey that was conducted within 15 days of your annual survey, either before or after, all right, you will not have, they will not count the deficiencies twice, okay? They're going to group the deficiencies, the same deficiencies, and count it as once, but they will take whatever scope and severity is the highest, and they will use that and apply it, okay? Now, unfortunately, I can't say if you've had a complaint survey that was 30 days before or after your survey that they'll actually do the same thing. It's really within just that 15-day survey, 15-day window. So most of you are very familiar with this. This is the survey deficiency score kind of matrix, and it looks at the weights for the different types of deficiencies related to scope and severity. But notice the points that are assigned. This is how you'll know how many points are going to be assigned to you based on how many deficiencies you've gotten in each survey window or each survey period that you've had. And this will help contribute to your overall score. Those points that you'll see in the parentheses are actually based off of the points that will be assigned on if your Department of Public Health needs to come out multiple times to look at revisits. So right here you'll see the table for repeat visits. All right, the first time they come out to make sure you're in compliance, there's no additional points that are assigned to you. But if they have to come out a second, third, or even a fourth time, then yes, you'll have more points assigned to your health inspection score, and that's where they start to weight things. So to calculate your survey score, before you can actually get a star rating, you have to figure out what your score is. So there's a quick and easy way that you can, well, I don't know if it's quick, but there is a way that you can actually do this on your own. So for the first step, you're going to list the deficiencies that you received on survey, if you received any, by each survey year. So you're going to look at your most recent year and then work back. So for you've had 3 years total. For your next step, you're going to assign the score, and you're going to go back to that survey scope and severity grid that we just took a look at, and you're going to add up the scores that way. And you're going to assign a score to each of the deficiencies. You want to sum up each year. Then, based off of each year, you're going to multiply your most recent survey by 0.5. You're going to then multiply your survey score from 2 years ago by 0.33. And then multiply your survey score from 3 years ago by 0.16. This helps give you that weighting that we talked about. Then for your final step, you're going to add all your, quote, new scores together after you've multiplied them, and that gives you your survey score. Now, you don't want to forget about those complaint investigations, though, all right? So take a look at not only your annual surveys, but then any complaint investigations or focus surveys that you received as well. Okay. Now, you have your 5-star staffing domain. Now, the staffing data is actually really interesting because a lot goes into that as well. Okay, the staffing information captures the number of hours of care on average that's provided to your residents each day. It includes your RNs, your director of nursing, your RNs with administrative duties, your full-time and part-time employees, and any agency or contract staff that you have as well. And the information in staffing data and the cut points of how the stars are assigned is based off of a CMS staffing study that was done a few years ago. So now, where does CMS get this information, and how does that calculate to your survey score, or your staffing score? It's actually from the data source that you fill out, the 671 form on your annual survey. So on that annual survey, you'll get that form, you fill it out, And so really pay attention to that and make sure that you've had a few people look at it to make sure that it's accurate, because you want to be able to capture really all that you're doing in your organization so that you can have the best staffing score that you can get. So your staffing information, it is based on 2 different data points. It's looking at your total nursing hours per resident day, so that's everybody in your nursing department, your RNs, your LPNs, and your CNAs. But it also then looks at just your RN hours per resident day as well. So you'll see here in this table, and when I'm pulling these tables, I'm actually pulling it right from the 5-star manual, so you have access to this information beyond just this presentation, and I'll show you how you can get to that. All right, so it looks at what the average hours per resident day should be, and this is based off of the national average, and it does say April 2012, but that's the last time that CMS actually updated this. So they're saying that the national average hours per resident per day for your total staffing is a little over 4, and it's a little under 1 for your registered nurses. Now, your staffing information is case mix adjusted, okay, and that's accounting for the differences in the level of need based off of the care of the residents that you have, and it's based off of your RUG 3 grouping. This is actually the calculation that you can use if you really wanted to do some fun math and to try to figure out what your staffing information score would be as well. Okay. Now, of the 2 staffing measures, the information that feeds into the overall staffing, they're both given equal weight. So when you group your RNs, your LPNs, and your CNAs together, and then just take a look at your RNs, those 2 that contribute to your star rating are given that equal weight. All right? And so based off of that, you're actually assigned a star rating based on a percentile-based method. So you'll see here from Table 4, that's again out of the manual, you'll see where you may fall based off of what your score ends up being. Then you're able to get your overall rating based off of how you performed in those 2 areas. So if we go back to this first table we took a look at, okay, right here, you're going to get a star rating based on just your RN, and then you're going to get a star rating based on all of your nursing staff together. And then based on how you did that, the average of that is where you would then fall into this overall staffing points and rating scale. Okay? So you'll see here that it's actually very difficult to get a 5-star rating in staffing because you need to have over 4.4, and for your total staffing, and then just for your RNs, you need to be over 0.7 to get your 5 stars. Everyone else would be a 4-star, and then, of course, it comes all the way down to a 3. So you got to really almost read this left to right. I'm sorry, right to left. I don't even know my right to left today. Okay. So your staffing score. As I said, you must obtain pretty high scores in order to get, your 4 or 5-star rating. But there's a caveat when it comes to the staffing score, and I don't mean this to confuse you even more, but in order to obtain a 4 or a 5-star rating in the staffing domain, so the overall staffing score that you're going to get, you must exceed the 5-star level for both your RN and your total staffing numbers, and we talked about that when I showed you the overall matrix. But to receive at least a 3-star rating, on both your RN and total staffing, and you must receive a rating of 4 or 5 stars in one of those domains just to get 4 stars. So think about that. To get 5 stars, you pretty much have to be perfect or exceed that in both of those scoring methodologies for overall staffing and RN. But to receive even a 4-star means both areas have to have at least 3-star rating, and then you must have 4 or 5 in one of the domains. It can get pretty complicated when you look at it that way. So polling question. True or false? I should not include my Director of Nursing RN hours on my 671 form. Let's see who is paying attention. If we can open up that polling question, please. And if you can provide your information, true or false, and hit submit. And we'll wait for those polling questions to come up. I know you all got it, so I'm sure you did. So we're going to move on, and we'll wait for that to pop up. All right, so we've looked at nursing home compare, and then we started looking at the 5-star rating, and we looked at the first domain, which was health inspection. We looked at the second domain, which was staffing, and now let's move on to the quality measure domain. That's the third one. So, of the quality measures that are on this, there are 11 quality measures out of the possible 18. So when we first looked at nursing home compare, we saw that there were so many of the long stay and there were some of the short stay. Well, when it comes to the 5-star rating, it does not look at all of those 18. It only takes 11 of them. It'll take 3 of your short stay measures and it'll take 8 of your long stay measures. Why just the 11? Well, CMS felt that these core measures had the highest reliability. And so some of the newest ones that were added just of February of this year were your long stay and your short stay antipsychotic medication measure as well. Okay. All right, so the results are up. Okay. So, yeah, you do want to include your director of nursing hours in your 671 form. Absolutely. It's meant to capture that. The directions and work with your surveyors to fill that out as well, but you do want to include that. Your RN is there, more than 40 hours a week, I am sure, at your facility. You want to make sure you're capturing that. Okay. So, back to the quality measures and looking at the 5-star domain. All right. This information is also reported by the nursing home based on their assessments of the residents using your MDS data. All right. So all the quality measure information is coming directly from you. The quality measures that are included, we mentioned that there are short stay and long stay are listed here. It's important to point out that catheters, self-report of moderate to severe pain under the long stay measures, and pressure ulcers under the short stay measures are actually risk adjusted. So that's already done for you as well. So your quality measure information is actually based on the 3 most recent quarters of data. So it's not just one quarter, it's actually an average of those 3 quarters. All right? In order to actually have information that contributes to the star rating, your short stay measures, you have to have a denominator, a minimum of 20 people. And for your long stay, it needs to be a minimum of 30. So for you smaller facilities, you'll have to really take a look at that to whether you actually have enough to contribute for that denominator score, okay? And your points are assigned based on your facility performance. And so scores are actually assigned on your quality measures, and in this scenario, you actually want higher scores or the better. And the calculations for each of the quality measures vary. So you'll want to take a look at that. Now, the caveat to this is that the quality measure information is that average of those 3 quarters, but there's a 6-month lag in that data. So keep that in mind. We're right now in quarter 4 of 2015, so you have to now count back 2 quarters, so there's a 6-month lag, all right, and that brings us back to quarter 1 of this year. All right, and so the information on Nursing Home Compare is taking those 3 quarters from quarter 1 and then the last 2 quarters of last year as well. All right, so the calculations of the QINs, as I mentioned, you can get anywhere from 20 to 100 points for each individual quality measure, and it's based on your facility performance. In this case, the higher the points, the better. So if you have 0% residents triggering for any different quality measure, you can get 100 points. And that's great, because that means that they're not triggering. The points are assigned based on national percentiles, so it's the same for every facility. All the 11 quality measures are given equal weight. There's no weighting here, okay? But your ADL quality measure is actually based on your state performance versus the national performance. So that's the only variation. It's still an average of how your state performs, but it does account for geographic differences within the country. And the points are summed across all your quality measures to create your total facility score related to your quality measures. So if you wanted to really actually figure out your quality measure score, all right, you can see the manual for details because each quality measure has its own formula to it, so it's too much to go into, and quite frankly, it's too much math. I don't want to do all that math. I'd rather CMS do it for me. But you can see where you'd actually fall based off of your quality measure star rating, based off of your points here. So as I mentioned throughout, there were some changes to the quality measure system earlier this year. Antipsychotic medication use was added, the short stay and the long stay. And CMS did change the methodology or the calculations and how to earn the points for 2 stars or greater facilities. And then you must meet the RN or total staffing by 4 or more stars to achieve a 4-star overall rating in the staffing measure. So the calculations were changed a little bit, and they were changed just based off of kind of new methodologies that were being used. So you may have seen, just based on these updates to the system, the 5-star system, you may have seen your own quality measure scores or any of your other staffing scores change just based off of that. Just a new calculation. So you could still be doing everything differently, but your star ratings may have been adjusted. So how do you calculate your overall star rating? Well, there's 3 simple steps for it. So you want to start with your health inspection rating, and that's why when you're looking at the 5-star program, we took each individual domain separately, and we start with health inspection. Think of health inspection as actually like the foundation of your overall star rating, because that's what we're trying to get to, right? What's my overall rating? Start with health inspection, okay? So you're going to figure out what your health inspection rating is, and we talked about that calculation. You're looking at your 3 years, and you're going to weight them. And then you're going to look at your staffing rating, all right? So you're going to add a star, starting with your health inspection. You're going to add a star if you actually received a 4 or a 5-star rating under staffing, okay? The caveat to this is, and it's greater than your health inspection rating. So if you started out with, a 3 for your health inspection, you're going to add a star, okay? You would subtract a star from staffing if you received a 1-star staffing rating. Then you're going to look at your quality measure rating. Now you've had your health inspection, you've added or subtracted a star for your staffing, and then you're actually going to look at your quality measure rating. You're going to add a star if you received 5 stars for your quality measures, and you're going to subtract a star if you received a 1-star in your quality measure rating. That's why you need to look at each of those 3 buckets as 3 distinct separate scores in order to try to figure out what your overall rating is, because again, it's not an average. Okay, and by doing all of this, starting with health inspection and then adding or subtracting staffing and adding or subtracting your quality measures, you would actually come out with your overall rating. Now, it can be a little confusing, so let's go over a couple examples as well. It's going to help us, I think, solidify this. Now, there's a few caveats to this, because of course there's caveats to all of it, isn't there? For your health inspection, okay, if you start with your health inspection as a 1-star, you are unable to gain additional stars more than 1, okay? So if you started your health inspection with 1, and you say you had a 5-star in staffing and you had a 5-star in quality measures, based off of the above calculation, you would end up being a 3-star facility. Well, the caveat is, if you start with a 1 in your health inspection, you cannot gain any more than 1 star. So no matter how you performed in those other 2 areas, you can only become a 2-star facility. The other caveat is if you're a special focus facility. If you're a special focus facility, you cannot exceed any more than 3 stars total. So say you started with a health inspection rating of 2, based off of the above calculation, you had 5 stars for staffing and quality measures, you'd gain an additional 2 stars to become a 4-star building. You cannot do that. If you're a special focus facility, you cap out at 3. So those are those 2 caveats. All right. So a quick polling question, and then we're going to move on to some of the examples. So if we can open up the polling question, that would be great. True or false? Nursing Home Compare publicly reports quality measures that don't contribute to my 5-star rating. Choose your answer, true or false. And then press submit at the bottom. And we're going to move on to some examples of calculating your score while we get the results to this calculated. All right, our first example. We have a health inspection rating of 3. So again, 3 distinct scoring methodologies here. We have a 3-star under health inspection, 1 star under staffing, and 3 stars under quality measures. So what are we going to do for the math? Right, our calculation. We start with our 3 stars because that's our foundation. That's the basis of our overall score. Now, we're going to subtract a star because of our performance in staffing. We only had a 1 star there. But for quality measures, what do you think we're going to do? We had a 3-star. Do you think we'll add or do you think we'll subtract? We're not going to do anything, actually. We're going to add 0 or subtract 0. Because 3 stars is right there in the middle, we do not add or lose a star. So our overall rating is now a 2. All right. How about the next example? We have a health inspection rating of 2, staffing rating of 3, and a quality measures rating of 5. So again, our calculation, we start with health inspection. So we start with a 2. Now with staffing, are we going to add or subtract? All right? I tricked you. We're not going to add anything there. 3 is right in the middle. We don't add or subtract anything there. But how about for quality measures, right? We started out with 5 stars. Do you think we're going to add or subtract anything there? Absolutely. We're going to add another star. Way to go. You performed really well for quality measures. So now this facility actually ends up with an overall rating of 3. Our next example. We have a health inspection rating of 1. We have a staffing rating of 5 and a quality measure rating of 5 as well. So our calculation, we start with our 1 star, right, in health inspection. And we have 5 stars for staffing. What are we going to do there? Absolutely. We're going to add a star. Way to go. You have the staffing that performed really well. Now, how about for quality measures, right? We had 5. Would we be adding a star here? You're right. We're not going to be adding a star here, okay? Because the caveat for this is that your health inspection was started with a 1 star. And when you have a 1 star in health inspection, you cannot gain any more than 1 star, no matter your performance in the other 2 domains. So this facility would be an overall 2-star facility. Okay. Now we have an example for a special focus facility. We have a health inspection rating of 3, a staffing rating of 5, and a quality measure rating of 3. How do you think we're going to end up for our overall rating? Our calculation is going to start with our 3 stars, right? That's our base. That's where we're going to start. In our staffing rating, we actually had 5 stars. What do you think we're going to do here? No, we're not going to add a star here for staffing rating, right? Yes. Is everyone questioning why? Let's work through the rest of it. And for quality measures, will we add anything? No, we weren't going to add anything because quality measures was 3, and you wouldn't add or subtract for that. So this is an overall star rating of 3. And a lot of you may be asking, why is it that we didn't gain that star for staffing? Because if you remember, I said one of the caveats is if you're a special focus facility, you are capped at 3 stars. You cannot gain any more regardless of your performance based on staffing or quality measures if you started with 3 stars. That's my little trick to make sure you were all paying attention. All right. So the data and the time frames and the updates for looking at your 5-star information in Nursing Home Compare. All right. Your health and fire safety inspections, they do look at 3 years' worth of surveys, and they include your complaint and your focus surveys. All right. All that information is updated monthly. It's updated on the 2nd Tuesday of every month. Now, I listed here your fire inspections, but that doesn't mean your fire inspections actually contribute to your 5-star rating. It's just when the information on Nursing Home Compare is updated, right? So you want to take a look at that. And when I say it's updated monthly, it doesn't necessarily mean that your information is going to change every month, but your Department of Public Health actually, once your surveys are completed and they've done all their paperwork they need to do, and it's uploaded into the CMS system, CMS will then update it to Nursing Home Compare. And your Department of Public Health does that every month. Your staffing information. Right, your staffing information is a snapshot of those 2 weeks during your survey. Remember, it's that 671 form. So make sure that you're really paying close attention to that form during survey and making sure you're completing it to capture all of the staffing that you're providing. All right, and that information is updated monthly on that second Tuesday as well, because the staffing information is captured during survey. It's going to be uploaded with your survey information as well. And your quality measure information, remember, it's an average of those 3 quarters, and it's a rolling 3 quarters, but there's a 6-month lag, all right? And that's updated every quarter, and that's updated on the 3rd Thursday of every month. So when you're looking at kind of those rolling quarters of information, make sure that you wait until that 3rd Thursday to see if your star rating will change at all. Okay. So this should help you with some of the information and when possibly your star rating could change. And I mentioned the health and fire safety inspections and the staffing information is updated monthly. It may not mean that your information is updated monthly, but it may mean that you can see changes to your overall score. Because remember, it's a bell curve of how the facilities are ranked according to their overall rating of 5-star all the way down to 1-star. So depending on how your neighbors performed or how somebody else within your state may have performed, it could affect your rating if you're kind of on the cusp between, say, a 4 and a 5-star or a 3 and a 4-star or a 2 and a 3-star. So what drives your 5-star rating? It's NBS 3.0 information, absolutely. So all of this information that we talked about, make sure that you're taking a look at that, okay? Pull down the 5-star technical users guide. That will give you all the information you need to know about your calculations, about more of the information of what I explained today in this presentation. You know, if you like math and you want to be able to do it, by all means, you can certainly calculate all your scores out on your own. Okay. So our polling question, the question that we had asked was, that's a good question, so we remember it. Looking at Nursing Home Compare, and it's publicly reported. And we looked at Nursing Home Compare is a publicly report quality measures that don't contribute to your 5-star rating. All right, absolutely. True is the correct answer because Nursing Home Compare has 18 quality measures that are publicly reported, and your 5-star rating actually only has 11 of the quality measures that contribute to that score. So way to go. Okay. So now, we talked about so many different data sources. We talked about Nursing Home Compare. We talked about 5-star rating. We talked about the different domains within 5-star. We talked about your TASPA reports, all of that information. So kind of what goes where and how do you get this information? Here's a crosswalk that you can look at. All right, of your short stay measures, Nursing Home Compare reports all of them, okay? Your moderate to severe pain, new and worsening pressure ulcers, your vaccinations, and antipsychotic medications. The CASPA reports that you pull down, and your CASPA reports are available to you at any time from your MDS computer. Pull down your CASPA reports, you're going to actually only have 3 of those measures in your report. Your composite score doesn't report on any of your short stay measures, and your 5-star rating, only 3 of those measures contribute to your 5-star rating. And then you'll see so much more when it comes to long stay measures. What's actually publicly reported on Nursing Home Compare, what's available on your CASPA reports, what's available on your composite score, or your STAR reports that you'll get from the QIN-QIO collaborative, and then your 5-star rating and what contributes to that. So if, say you have your leadership, your administrator, your owners, your corporation, your board, whatever it is saying, you know, why is it that you're only a 3-star? Or why is it that, you know, we fell from 5 to 4, or whatever it is? You want to be able to come to this crosswalk and say, okay, well, what contributes to my 5-star rating? Because if you start looking at, say, incontinence for low risk, or you want to look at your vaccination rates or anything like that, which by all means, don't stop doing that. I mean, we certainly want to make sure that you're looking at all of your quality measures. But to put a quality improvement project or a quality improvement initiative surrounding one of those, though good, is not going to change your 5-star rating. And so if you really want to be able to drill down to what's going to contribute to your 5-star and what's going to make a difference in your rating scores, you want to just look at those quality measures, okay? Same thing for your CASPA report here. Maybe on Nursing Home Compare, It doesn't report falls. So you want to know what's going on with falls in my organization. How do I look at that? Well, you can go to your CASPER report, and that's where that information is available to you, okay? So this is just a nice crosswalk between both the short stay and long stay to be able to say kind of what information is housed where. All right, so looking at your data, I mentioned CASPER, and so for those of you who aren't familiar with your CASPER reports, there are a variety of reports that are available to you through your MDS computer. All right, you can pull down this information on a monthly basis. You can pull it down for an entire year. You're able to actually look at your report and decide what reporting period you want to take a look at. What I would recommend, if you're worried about your 5-star rating and what contributes to that, you're going to want to go into CASPER, or into your MDS computer, into your CASPER reports, and pull down the reporting period for the exact same 3 quarters that Nursing Home Compare is publicly reporting your information on. Okay? Now, we know there's a 6-month lag, which is really unfortunate, and I'm sure super frustrating for you, because that's what the public's looking at. And it could be that you said, oh my gosh, there was an issue, and we've taken care of it, and we've resolved it, and our scores are so much better now, but unfortunately it's going to take a while for that to show up. All right? So that's when actually your messaging to your residents and your families and your staff becomes so important, because you want to make sure that they're really tuned in to what information is available on Nursing Home Compare and how that contributes to the information and projects you're doing within your organization. So those CASPER reports are real time. You can pull those down for how you performed in September, for instance, and you just want to take a look at that. All right, use it to validate what's on Nursing Home Compare, use it to validate your internal committees and any other tracking that may be happening, and then of course with your MDS and your care planning, take a look at that. You can actually get resident level data when you're looking at your CASPER reports to say, wow, Mrs. Jones is triggering for an antipsychotic medication, but I don't remember her having an antipsychotic, diagnosis. So let's take a look at that. Your other data is your composite score. Again, drives improvement projects based with the support of the QIN-QIO, and it also benchmarks you against others and others' performance. And then, of course, your 5-star program, which we just reviewed all of that as well. You can calculate your own score, you can benchmark yourself, but then again, use it to make sure that people understand the information that you have and what's publicly available. Now, if you have questions related to your 5-star rating, make sure that you use the preview helpline that CMS makes available for 3 short days every quarter when that information is going to change. All right? You will get notice through your MDS computer. You'll get a notice of that, and there's a helpline that's available for 3 short days that you can call. They can walk you through every calculation that you have. So if you want to know how you're performing and you just don't seem to get it because your math doesn't add up to their math, have them walk you through it. They can do that for you. We had one facility that actually went from a 5-star to a 4-star in staffing and couldn't figure out why. They called this helpline. The helpline walked them through all the math. And what it came down to is they were 1/100th of a point away from the cut point. So it doesn't necessarily mean that you've done anything different, or you have to put some huge quality improvement project behind it. Find out kind of what that math is first. So when should you use your information and your data? Always. All right. Data is what's going to help you make decisions and guide your changes. It's going to be how you measure your improvement projects. Use it to educate your staff, residents, and families. You can budget accordingly to it. Where is it that we need to invest more dollars or not? Should we put in more staffing? Should we educate differently? And data, I think, is one of the most powerful mechanisms for telling stories. I take a huge pile of data and I try to get it to tell stories. And Stephen Levitt had said that, and I think it's a great way to capture what data and nursing homes should be able to be doing for you as well. So we're going to open it up. This is the end of my presentation. We'll open it up for questions. We have one question in chat. Somebody said, I am a small facility. How am I calculated if I don't have the 20 or 30 residents for the denominator? That is a fantastic question, and thank you for answering that. For those facilities who actually don't have enough to calculate your denominator, you may see something up on Nursing Home Compare that says, like, NA, I think it says, or, denominator too smaller. There's some indication to say that you actually don't calculate a score. Now, if that's one of the quality measures that contributes to your 5-star rating, here's another kind of caveat to the whole 5-star system. And I am so sorry I am the bearer of bad news for most of you related to all these caveats. Luckily, we're on a webinar and nobody can throw tomatoes at me. But if you do not have enough information to calculate either a denominator for short stay or long stay, what CMS does, in order to be able to give you an overall star rating, they will take the average of the state's performance in that quality measure and substitute your lack of data in that area because of your denominator and use that average. Now, if you're a facility that may be struggling in that quality measure and the state average is better than yours, then you kind of make out in that area. But unfortunately, if you're a smaller facility who may be performing better than the state average, when CMS uses that state average, it could pull down your whole star rating. And that actually did happen to a facility I worked with, and we couldn't figure out what was going on until we went through each of the different domains and really looked at everything. It is in the 5-star manual. That information is there, and so it took us a while to kind of figure that out. And because the state average was lower than their usual facility performance, it pulled down their star rating from 5 to 4. So, great question. Thank you for answering it. I'm glad I was able to clarify.
We've actually had 2 more come in chat. How can we fix the staffing number that was submitted on the 671 form if there was an error?
Great question. Very good question. Contact your Department of Public Health. Depending on when you actually determine that there was an error on the 671 form, and if they, depending on where they are within their upload process to the CMS system, they may be able to stop the upload and be able to fix the form based off of what you provide to them. But honestly, I contact your Department of Public Health and figure out where they are with that and if they can work with you. It has happened in the past, so it's certainly worth a call and an ask.
And we also have, does the overall number of beds certified have an effect on the scores?
That's a good question. I'm going to assume that when you say overall number of beds certified means Medicare and Medicaid certified, because those are the only beds that would contribute to your scores. Now, if you are a large facility compared to a small facility, yes, it can contribute in the fact that, anybody who's really less than 100 beds, even 1 or 2 residents can make your percentages seem higher than other facilities that were over 100 beds, for instance. Okay, because your denominator is smaller, even 1 or 2 residents can really send a percentage higher and look like you have more of an issue, but when you actually look at actual numbers of people, it may just be 1 or 2 residents. I hope that answers your question. If it doesn't, please let us know and I can clarify.
And then another one actually just came in, I believe, in regards to the last question, but who in the Department of Public Health should we contact? I guess if they have questions on fixing the 671 form.
Okay, yes, I would assume it's on the 671 form as well. So who in your Department of Public Health should you contact? I would start with your survey kind of lead, your team lead for your survey, who you had contact with then. If you're not able to get in contact with them, then I would go up to whoever is in charge of the nursing home licensure division, and it could be a manager that you contact, and then maybe a branch chief. But I'd start with your surveyor team lead first.
Excellent. Well, those are all the questions in chat, but if anyone on the line would like to ask a question, you can press #6 to unmute your line and ask Michelle a question. Again, that's #6 if you want to ask a question.
I know that we talked about a lot of information in kind of a short period of time, so feel free if you want to email me or give me a call to ask any questions. I'm happy to answer any questions that you may have if you think of them later.
Another question just came in the chat. How long after survey how long after survey are you put back into compliance? Does it take for the overall star rating to change from your survey results?
That's a great question. So as soon as you're, and this is why I'm assuming most of the departments of public health operate, is that once you've had your survey and they're able to close out your survey, so, you're put back into compliance, there's no outstanding IDRs or IIDRs, and they kind of closed it and are able to upload that information into Nursing Home Compare. As soon as that's done, that following month is when CMS will then upload it, and that happens on the second Tuesday of every month. So it should happen shortly after that. If you have questions about how long it may take, then you would contact, again, your survey team lead, and if they can't answer the question, have them direct you to their manager, and the manager should be able to let you know kind of where you are in queue for those uploads. At least I know in my state, they try to work really hard to getting that information updated as quickly as possible and uploaded into the system so that your scores don't take a long time. It should happen within a couple of months.
Again, if you have a question on the line and you'd like to ask it, you can press #6 to ask a question. Oh, does the state or federal government determine star rating for survey?
That's a great question. So your star rating is based off of how you scored. So the score is the same, all right, for depending on your scope and severity. So go back to that grid that we looked at. I don't know if I can get back to that slide quick enough. But feel free to go back to that grid and take a look. I'm trying to see if I can get to it. Yeah. So this is the one that I want to take a look at. So you'll see the points that are assigned. All right. That's how you find out your score, and then your score is actually going to determine your star rating, and that's included in the manual, so you can take a look at that. Okay. And that's equal for everybody.
All right. Well, thank you, Michelle, for that wonderful presentation. Again, if you guys have any additional questions, Michelle has included her information in the PowerPoint deck. When you close out of this webinar, you will be taken automatically to the evaluation. If you could fill that out, we'd greatly appreciate it. If you don't have time today or you're sharing your computer with somebody else, we will be sending out a follow-up email tomorrow with a link to the evaluation as well as the link to where the PowerPoint recording and transcript for this webinar will be located. The PowerPoint has been added to our website, and I did put the link to that in chat, and I'll do it again. So if you guys want to go there, you can download the presentation from today. And thank you guys for attending. And Michelle's got one more thing to say.
Yes, hi, it's me again. I just wanted to make sure that I provided some further information related to the last question about the star ratings related to survey. The scoring methodology is the same no matter what, how you got your deficiency, whether you're in Alabama or if you're in Alaska. It's the same, but your relative performance is within each state. Okay, so your scoring then and the distribution of that bell curve of scoring will be determined by each state. So if, say, and we all say it, right? We all say some state is easier on survey than other states. Whether that's true or not, I don't know. But because there is, humans involved with this, there's that element of kind of subjectivity. And we also have states with the QIS survey versus traditional survey. So, yes, your scoring then and your bell curve methodology is actually within your state, but the scoring is applies to each individual kind of deficiency on its own. But then it will determine how you perform within your state. So hopefully that clarifies and doesn't confuse anyone further. But feel free to contact me if you have any follow-up questions.
All righty. Thank you, everyone. Have a great afternoon.
The leader has disconnected. The conference will be terminated in 5 minutes.